Hey guys, you're with Evo, and today we'll be talking about exercise. So guys, you're with Evo again, and as I mentioned before, today we'll be talking about exercise. First, why is exercise important? It's important because it improves the self-esteem of a person. By doing that, it prevents depression. As I said, self-esteem is really important for a person because the way he looks at him can actually benefit his health in a lot of ways. Another reason why we should exercise is because it promotes muscle growth, no? And not only muscle growth, but it prevents atrophy. We don't want a patient who comes here for one type of sickness to live with another type of problem, or who comes with one problem and lives with another. We want him to be as good as possible. And by doing this, we would like to prevent atrophy. Also, why we should exercise, not only we, but our patients as well, is because it promotes the good heart rate, the good blood pressure, the good respiratory rate, and prevents obesity. We don't want someone to become obese when they're in a hospital because, again, that puts pressure on the heart, on the arteries, on the whole system, the whole body. Obesity is not good at all. So now that we know why we should exercise, the question is how we can exercise with our clients, patients, call them however. So we have to make sure that we put some small and achievable goals ahead of them. We can't just like walk to a room of a 5-year-old woman and be like, hey, today we'll be running a 5K. No, that's not how it works. Today we're gonna walk here and say like, hello, Miss Smith, can you move from here to there? Can you move the same distance you were able to move yesterday? And put them some small achievable goals. Hey, okay, I see you can move from one end of the room to the other and come back, but can you do this 2 times or times and a half? Or can you take a few extra steps? What can you do that can make you better than yesterday? And you want to make sure those are small and achievable, because if they're not achievable, then the person's going to lose the interest of exercising, and we're going to promote depression. And as I said, that's something that we definitely don't want to do. So at the same time, how to exercise, now the question is, what can we do while our patient's exercising? Miss Smith, she's walking there, doing her stuff, but what can we observe? Well, mainly we can observe the range of motion. As with hygiene, here with exercising, there's a lot of movement and the joints move a lot, so we can see, can she move her joints as before? Can she? Why? What is the reason for that? What's the reason for this? We'll try to assess whatever we can assess. For example, can she lift her shoulder that high? Well, she was able to lift a little bit higher yesterday. So, what has changed? Is there any pain while lifting her shoulders? We want to try to assess, to investigate, and see if the patient is improving and if he's not improving. And if he's not improving, why? Always have this question, always have it somewhere behind your bag, just ask why. Why is this happening and what can I do to prevent it? So another type we can do while assessing is see if they can passively or actively lift up their legs, arms, or whatever. For example, there's difference between a passive and an active lifting. As you know, active lifting is the one we do every single day. We just raise our arm, and it's active because we're the one using the energy. Another type of lifting is a passive lifting. It's like when someone else uses their arm to lift ours. That's passive. And the third type of lifting is actively passively. When a patient cannot fully lift their arm actively because they're kind of lacking the muscle strength. So they lift up to a point, then we provide some support, then they lift a little bit more, then we provide some more support so they can relax, and then they lift it all the way up and we provide support again. And going down the same way. We want to make sure again everything is safe. So, another thing we can do with our assessment of the patient is think what kind of flexion, extension, abduction, adductions they can do. So, while asking, we're going to look for flexions, adductions. Those terms might sound a little bit confusing, but I'm briefly going to go over them. So, flexion and extension. So, flexion is basically when your arm or your muscle flexes, it shortens. And so, for example, in this case, my forearm becomes closer to my body. An extension is when the muscle actually extends, and by this, my arm goes away from the body. Another thing is adduction and abduction. When something gets adducted, it comes closer to the body, and when it gets abducted, it becomes further away from the body. Those are again medical terms that we should use. Actually, we must use in our medical practice, in our medical records, because those are legal documents as well. And the other two types of movement I want to talk about is first opposition, basically that when the thumb meets the other part of the hand. For example, the forefinger, the middle finger, the pinky, that's an opposition. And then we have medial and lateral rotation. Medial rotation, as you can see, my leg can be towards me. I'm just going to rotate it. And then we have lateral, which is away from me. So those are all types of movement, and basically that's everything with exercise. And later on, we're going to move to the types of positions we have. So guys, now we're gonna speak about positions. In this video you won't see me, but it will be easier for you to observe the positions and figure out the logic behind them. So first let's start with the supine position. The supine position is extremely easy to remember. Basically you lie down on your spine, and it's easy for the doctors and nurses to assess the thorax, the neck, the heart, basically everything that's on the front side, the ventricle side of the body. And then you have the opposite, which is the prone position, which is extremely good for people who have spinal injuries and you want to examine the dorsal side of the body. Again, there's the back side of the body, and it's not really tolerated, only for people who have problem breathing. So moving on to positions, then we're going to see the Sims position. It's used mostly for examining the rectum and some in the female genitalia, and again it has the same limitation as the prone position, although it's considered to be more comfortable for the patient than the prone itself. And another position that we would like to take a look at is the lateral position. In this position you're on your side, and it's usually used for examining either a part of your body, or sometimes the heart is released with her from that position, as well as the supine. So another position that we're going to pay a little bit attention to is going to be the Fowler's position. In that position you're going to put most of the patients who have problem breathing or limitations with the breathing. Basically it reduces the pressure on the lungs. And then we're gonna move to the last position, but not the least important. It's gonna be the Treisenberg and the reverse Treisenberg. Basically, the Treisenberg position is position that's used mostly in a critical settings when you want to promote venous return to the heart and the lungs as soon as possible. And the reverse Treisenberg is for people who are having problem breathing, but they had kind of some problems with the spine and we cannot flex the spine at all. So then we're gonna go with the reverse Treisenberg. So guys, that was the short video about positions, and let me know if you have any questions. Thank you.